The session today is cross-cultural views in healthcare. This is a healthcare 101 to support newcomers, new Canadians, and folks from out of the province or country. We'll be covering the ways in which our medical system may differ from other provinces, or even more importantly, other countries, and how you can best navigate to get the best care that's available for yourself and for your family and for your loved ones. We're really fortunate today to be joined by Dr. Anna Pesantez, who is a family doctor in Burnaby. She was born in Ecuador and did her degree there. She's worked in the intensive care unit for 3 years and also worked in the Amazon jungle for communities out of reach. She's been in Canada since 2011 and did a family medicine residency in Burnaby. So she works at a walk-in clinic as well as serving in one of the long-term care facilities in Burnaby. Just before we get started, I do want to let you know that yes, we are recording this session so that we'll be able to provide it to folks who aren't able to attend. You'll be able to see the session or let other people know about it. It will be on the burnabypcn.ca website. If you have questions as you go through, please put them in the chat, and we'll make sure that as we have time, Dr. Pesantez will look to answer them. She'll probably do her presentation first and then answer questions later. And again, this and other DocTalk presentations, as well as all of the resources that are available through the Burnaby PCN, are available on the burnabypcn.ca website. It's a pretty good resource for a variety of different pieces. So if you get time to look, please look there. So, and I think without further ado, I'm going to turn it over to Dr. Pesantez. Welcome.
Thank you so much, Jeff. Thank you so much to everybody that is here with us today. I have to say, as an immigrant myself, I did have some difficulties to understand the system because it was quite different from my country. And currently I have a clinic where I have different patients with different backgrounds. And I find that the main question that they have the first time that I met them is, how does the healthcare work? And what should I be doing to get good healthcare for myself? And that's kind of like the question that I was trying to answer today. Sorry, I'm just going to share my screen because I have a presentation for us. Sorry. Perfect. So I am going to talk about the different, I want to talk about the Canadian medical system in general. The medical system all over the world is very different. I have a lot of questions from new immigrants, from people that are born in Canada but live outside of the country, and a lot of people that are just visitors or tourists that require help when they are here in Canada. I have found that there's a lot of myths around the Canadian healthcare system that sometimes have come from different movies. Like there's even a movie called Psycho from Mr. Moore that kind of talks about how our healthcare is free. But I have found that a lot of people, once they arrive here, they have difficulty accessing healthcare. The biggest thing that I want for everybody to know is that the main thing that they tell us is that Canadian system, your medical system, is completely free. And this is something that I have found that it's not the correct word to describe the Canadian healthcare. Is the system is quite complex. And one of the things that happens is that everybody needs to be enrolled into the system to be able to access it. As any medical system is quite costly, so it needs money to run properly. The way that Canada finds money to be able to pay for people to access the system, it usually comes from different resources. One of the bigger one is the federal taxes, meaning that Canada as a country gathered this money from our taxes, and a percentage of that comes into each province. This part of the money really helps to cover a lot of the services, but for every part of the healthcare to work properly, sometimes they also need things like charitable, like contributions from private people. And we can see this usually during the year. There are things on TV like the charities that they want to gather money for a specific foundations like the Children's Hospital or the Canucks Home. So this type of money help for the services to be able to be free. A lot of Canadians also have the option to have private insurance. Private insurance is mainly used to cover extended benefits or extended health that sometimes or most of the times are not covered by your federal taxes or your regular insurance. And within the system, once you go to a doctor's office or you go to allied health providers, there could be some services that you need to make out-of-pocket payments. I'm just going to talk about this one a little bit later. So, because I just want to focus, start from the beginning, right? Canada as a province gathers the money from your federal taxes, and then 1% of that goes to the province. Each province mandates its own healthcare system, and there are some difference in between some of them. Depending on how you access the service, usually you will connect with a family doctor, and the family doctor will be the one that will guide you on which services according to the disease that you are having or the needs that you have are available to you cover under your MSP. MSP is the big word that we use here in British Columbia. It's called, it's the medical service plan, which means that that's the insurance that we use here in British Columbia. There is a process that everybody has to go through to be able to enroll to it, but nobody, everybody's, the eligibility criteria is very broad. And I'm going to talk about that a little bit later. Once you enroll with your medical service plan, you get the number that is called your personal health number. Whenever you're going to access any of the medical services in Canada, the first thing that they are going to ask you is either your card with your PHN or your PHN number. Because this is the number that gives the information to the medical practitioners or the secretaries in any clinics or the nurses in the hospital for them to see if you are enrolled into the medical service plan. Sorry, this slide is talking a little bit more about the funding. This one has different layers. A lot of the public services can have a lot of public funding, but there are specific parts of the healthcare that are private. For example, even though the hospitals are paid by the taxes, a lot of the hospitals have a lot of a private side for them to be able to fully function. And that is when a lot of the contributions from charities help to be able to for a lot of the services to be provided without a cost to the patients. A lot of physician offices are private offices or owned like a small business by the physicians, meaning that everything that you see inside of your physician's office, the rent, the lights, the computer system, or even the secretary will be paid directly by the physician, but not from the government. The physician, though, most of the physicians work under MSP of the medical service plan. And what they do is whenever they see a patient, they get payments directly from the government. And this way we avoid for private payments from patients. Although there could be physicians that have opted out of the medical service plan and they will have more of a private system, which is, I have to say, a very gray zone, because in Canada, the public system and the healthcare accessibility is mandated all over Canada, and that's why it's accessible for everybody. There are certain things like prescription drugs or other type of healthcare, like home care or long-term care, even mental health care, that sometimes have a mixture of public funding and also private insurance, and at times to be able to access the entire program, you may need to do a little bit of an out-of-pocket payment, but it will depend where you go and who will see you. Now, the last layer will be services that are mostly and almost private. And that will be things like dental care that is not urgent or provided within a hospital. Vision care is a partially, things like glasses, contact lenses, and other things are usually privately paid, either by your insurance or out of pocket by the patient. But depending who you see, like an optometrist, sometimes they can have partial payments from the MSP if there is a pathology. I will talk about this a little bit later, but like you see, it's a combination of a public system with some private payments that allow us to be able to reach and to get all the services that are available for us according to our needs. Who is eligible to apply for the publicly funded insurance, the MSP? A lot of people, when they arrive to Canada, this is one of the biggest questions that I get a lot in my practice is I have patients that are either born in Canada that are not able to access healthcare in a public way. They need to pay privately. And this is because you need to be enrolled within the MSP. To be enrolled within MSP, you need to be a resident, especially here in BC. You need to be a resident here in BC. And you need to have been present or be present in the province for at least 6 months. There are people like First Nations, people that have a working visa and a student visa that are also able to access the medical system, the public funding. A lot of the people that are visitors or that have been in Canada for a very short period of time usually are advised to get extra insurance because they are not eligible for the public funding within a clinic, in a doctor's office or the hospital. And usually they need to make out-of-pocket payments for the access that they get, the care that they get here in Canada. This one is a big one for especially Canadians, but they are living abroad, or new immigrants. With new immigrants, there is a rule. Once you apply within for your MSP and your PHN number, you have a waiting period. And usually when you're applying for your visa, they tell you that when you arrive to Canada, it will be ideal for you to have insurance because the first 1 to 3 months are not covered by your MSP. And even though when you have MSP, the system and the healthcare is not costly, sometimes depending who you need to see or where you need to go, the money that you will have to pay out of pocket can be quite high. And sometimes you need to access the system within those 3 months because of you need refill for medication, accidents, or something, new symptoms, new diseases, right? A lot of the tourists that arrive to Canada, they will not have access directly to the medical insurance. They need to have insurance or they will have to pay out of pocket. The PHN application and the enrollment to the insurance is usually made by Health Insurance BC. If you're new to Canada, the advice is for you to apply for your MSP as soon as you arrive. That's mainly because of the waiting period that I mentioned. And it's a calculation between the month that you arrive plus usually a couple more months, that in general, it's around 3 months before your MSP, your PHN is approved and you're able to access your services. If you're moving from another province into, let's say, BC, there is a cross coverage between provinces, but the payment is not direct. So at times when you have to access the care of a physician, they may ask you to pay reduced fee upfront, and then you have to do your claim directly with your province for them to reimburse you for the care that you had. Sometimes that can have a little bit of a waiting period. And there are some services that at times I see have been declined. So it's definitely something that we need to make sure that we know or are aware, because sometimes you may have to do the out-of-pocket payment either temporarily or permanent, right? What is covered? Within your MSP, the access that you have is for all the medically necessary services. These services can be given or provided by physicians, either within an office or a hospital. It also, the medical MSP also covers midwives, and this is very common to be used by patients that are pregnant. The services cover also include diagnostic services like blood work and radiology like X-ray, CTs, and MRI. In this area for diagnostic services, the word medically necessary is really important, because within the guidelines, healthcare guidelines or the rules the doctor have to follow for treatment are different according to different countries. And sometimes they also change a little bit between provinces. And the blood work that is provided, or the services and diagnostic services that are provided to you, need to be within these guidelines for them to be considered medically necessary and for them to be covered under your public MSP or your MSP insurance. There are a couple of exemptions, especially for dental and oral surgery, but this is for processes that are very advanced or complicated and sometimes need to be performed within a hospital. All the other dental procedures are not covered under your MSP. As I mentioned before, if you meet a doctor or an optometrist in particular, you may have partial or full coverage of the eye examination when there is a diagnosis or the checkup for your eyes was medically necessary, and some orthodontic services in certain populations. The things that are not a benefit is vision exams could be covered by your optometrist if you are age 0 to 18. Sometimes, depending the optometrist that you see, they are allowed to, on top of what the government pays for the exam, they are allowed to charge a little bit extra. So you may still need to make an out-of-pocket payment. Sometimes these out-of-pocket payments can be covered by your insurance. There are no available, or it's not a benefit if you do have an exam between 19-year-old and 64 years old. Once you're 65, some of the exams again are covered under your MSP. Dental, like cleanings, fillings, the regular things that a dentist will see you for, are usually mostly covered by extended health or out-of-pocket payments. Podiatries, the doctor mainly checks on your feet if there are problems on the feet. They are in general not a benefit. They are not even within the medical system. You do not need a referral. I will speak a little bit more about the referral system later. And usually you are able to, with this type of practitioner, you're able to book your appointment yourself without having to visit a doctor first. But it will be either covered by your insurance, depending on your insurance, or out of pocket. Dietitian is another one. Counseling is a big one because it's usually needed. With counseling though, sometimes if you are part of a family practice or you are under a family doctor, there's some services that are partially covered. In some provinces, this is something that will be covered again under your family doctor. The bigger one that a lot of people require if they have any injuries will be the allied health. Services like physiotherapy, massage therapy, acupuncture, chiropractor, they are usually not covered under your MSP. They are mostly covered under your physiotherapy, under your insurance, or you need to make an out-of-pocket payment. The exceptions will be if you get into a car accident and you have coverage by MSP, you can apply to a different insurance that is called ICBC, and they manage some of the bills depending on your injury and depending on their assessment. And the other one will be a lot of the workers in different settings have another insurance that is called WorkSafeBC, which is again something that your employer pays for you and will cover you only in case that you have an accident at work. Usually, and so we have three insurance services here in BC. One will be the MSP, which covers mostly all of the regular things. ICBC, which is directed towards car accidents. And then the WorkSafeBC, which is for patients that work and had an accident at work. There are things that are not medically necessarily. Services that don't fit the guidelines for the physicians, they are not going to be covered by MSP. Couple of things that are really big here will be cosmetic surgery. Let's say a mole on the face that I don't like, but it's not causing any distress or any problems, and it does not look malignant, but I want it to be removed from my face, that will fall into cosmetic surgery. So that will be an out-of-payment pocket. I'm not sure if insurance is covered. I'm thinking most of the times I have not seen them being covered. A lot of the preventive services and screening tests that are not supported by evidence and that have not proved to have any medical effectiveness. For example, routine annual complete examinations or whole body CT scans. There are also tests like prostate specific antigen, the one that we do for checking prostate. There are some limitations that we have there. MSP stopped covering the complete physical because they found that it was not improving the health that patients, the health in patients, and it was a costly service. If you are the type of, if you want to know where my health is, how my health is doing, according to your age, there are some tests that as doctors following the guidelines, we can request. But if you would like to have extended testing or tests that are not within those guidelines, those will not be covered by your MSP, and you will have to pay for them out of pocket or privately. I have rarely seen insurance companies cover for that. This one is one that I usually see when you have alternative practitioners. Naturopaths tend to not follow guidelines from the medical system, and they are different type of medicine, right? And sometimes the amount of the testing that they want are not covered within the age or the requirements from the guidelines. So some of this or most of these tests are not covered by your MSP. As I said before, eyeglasses, hearing aids, and other equipment are not covered by MSP. Usually these ones are covered under your extended insurance. For prescription drugs, so there is some partial coverage. Some of them can be covered for via pharmacare, but there are some limitations and you need to apply for this to be covered. Usually I've seen this one happening mostly with people with low income or with certain medications, but most prescription drugs are again a payment out of pocket or covered by your insurance. Services by counselors and psychologists. This one, I wanted to talk about this one again because even though these services are not covered by your MSP, they tend to have system in which some places will charge you according to your income. So you can find a counselor or a psychologist for a very high rate, but in some places, if you do not have the money to pay a lot for a counselor or a psychologist visit, they may take your income into account to charge you a reduced rate. A lot of the medical examinations, medical certificate, or tests required for other things that are not part of your MSP are also going to be paid out of pocket and not covered by your MSP. It is common here in BC that ICBC, the insurance that covers drivers, has regular health examinations for some patients. I may say then patients that have heart conditions, diabetes, need some tests. Sometimes you get a form in your mail saying that you need to fill that for your driver's license to continue to be valid. But you need a lot of the doctors and most doctors will charge you privately for that form because ICBC does not cover for it and your MSP does not cover it. A lot of employment places require you to have a complete physical, or they want a form stating that you're fit mentally and physically for you to be able to work at certain places. This will be a certificate that again will not be covered under your MSP, but it will need to be out of pocket because most workplaces will not cover that either. If you're applying for life insurance, that is another privately paid because it's outside of your MSP. Not medically necessarily, it's given by a third insurance company. This certificate or examination will need to be paid out of pocket. Some schools or universities sometimes require certain certificates, or they will like, the most common one that I see is they like to see your immunization history, depending on what you're studying as well. This will be, again, you will require some testing if you don't have your records. And this test, as well as the form, will have it will be privately paid. Depending on age or diseases, there are certain recreational activities or sport activities, even some gyms. Sometimes they would like to make sure that you're healthy to be able to do really heavy activities. And they would like for you to have a certificate saying that it will be okay for you to do this sport. Again, another privately paid. One more will be once you apply for immigration, you need to, as part of the process, you need to pass the immigration complete exam and some testing. All these tests, as well as the examination, even if you're already in Canada, even if you're already covered under MSP, they are not covered. It will be privately paid because it's necessarily for your visa, but it's not medically necessary. The way that the system works here in BC, and the center of the system is the family doctor. The first thing that I say to all the patients that arrive to Canada or that I meet, I tell them that the best thing that you can do for yourself is find a family doctor. The family doctor is the person that is going to guide you through the system and is the person that you will have the regular contact. It's a little difficult sometimes to find a family physician, and sometimes there are wait lists, but there are other ways that you can access a doctor if you need them. One of them will be walk-in clinics. There are many around, as well as the urgent care center. And last, if needed, will be the emergency. If you're new and you don't have any information about how to access the doctor here in BC, and in Burnaby, we have a good system. If you go to the Burnaby Divisions of Family Practice, they do have a tab where they tell you how to find a doctor and you fill a form. Sadly, we are a little bit short of doctors at this time, and I believe that this page is disabled until January. But whenever it's open again, it's a good idea for you to put your name and information into this website because they will help you find a doctor within your area. I have a lot of patients that, because it is difficult to find a family doctor, they sometimes try to find doctors in different areas according to where they work or where is more accessible for them. But definitely a family physician is a big asset for you to be able to be directed properly within the system. If you don't have a family physician, my advice is usually walk-in clinic is a good idea if you don't have a point of contact. The main thing will be, ideally, our computer system is not connected through offices, hospital, and specialists. So if you have seen a person in one clinic and then you go to a different clinic, the second clinic will not have the information that the first clinic have, like exam test results or reports from a specialist. So if you do use walk-in clinics, it's ideal for you to use the same place or around the same doctor for them to be able to have a little bit more follow-up until you find your family doctor. Urgent care center is for more urgent needs. They don't work like a walk-in clinic. Like in a walk-in clinic, let's say you're pregnant, you need to see somebody to help you with your pregnancy. The walk-in clinic can direct you or refer you to the maternity people or the people that are going to help you through your pregnancy. The urgent care center, their role is a little bit more things that are more urgent. So walk-in clinic will be your first point of contact. And then the emergency, of course, for all the scary things or when you're really unwell, it's a place that is always open and it will be covered under your MSP. What do you need to expect? Once, let's say you already have an appointment at walk-in clinic or you got a family doctor, what should you expect at the appointment? Different countries and different provinces have different amount of times for your appointment with your physician. Mostly here in BC, you have to expect that your physician is going to give you around 10 minutes and your appointment will last 10 minutes. In this meeting, as a family doctor, we're usually able to discuss 1 or 2 problems, depending on the severity, because this time is limited. And we usually, sometimes there's people that wait to see a doctor for a very long time. And when they come to the clinic, to the appointment, they have this long list of all the things that they have been having through the year, but they have not come because they were getting more and more. So that will be 10 problems will be really difficult to manage in 10 minutes. What I usually tell to my patients is, we need to do more appointments to be able to address all the issues, because if I try to do 10 things in 10 minutes, I'm not going to do a very good job. If I do 1 or 2 problems, I am able to ask you all the questions that I need to understand what you have. And probably that will be more helpful for me to help you and to know which test I need to ask for. Especially if it's something really big or longer, like I am tired or I'm not sleeping, or I have anxiety or depression. I find that these meetings require a little bit more of a connection between the physician and the patient, and sometimes they tend to have longer meetings. It's difficult to address that plus other little things. And I find that when you focus more in one, you can address it properly. Be prepared to need more than 1 appointment to address the problem. Sometimes we do need to follow up on what you're feeling while we are doing some blood tests, while we're doing some tests with medications, and it will need for you to make a follow-up appointment. As I said, once you talk with your family physician, you have your 10 minutes, your family physician has an idea of how can they help you. They may request blood tests. They may request x-rays or ultrasounds, and usually these services are not done within the clinic. There are third-party places where you have to go and do these tests. For blood tests here in BC will be live labs. You need to make right now with the pandemic, depending the live lab. So you can just Google live labs. There's different locations all over BC. Depending where you go, some of them are asking you to make an online appointment for you to go there, especially right now because of the COVID restrictions. Some of them can take some patients in a walk-in basis. It's really difficult depending on it's really different depending on the location. And for radiology, again, there's different places that you can go, different wait times, depending on the location. There are some that are faster, there are some that are a little bit more booked. So sometimes if you do get an x-ray and the doctor asks you, in my clinic, we usually give a list of the locations that are available, and then you have to book your own appointment. Sometimes I do ask my patients to, if it's something urgent, to ask more than one place. And if definitely they are having some difficulty and it's an urgent test, to get back to me to see what I can do to help them. Through your family doctor, you can access special services. Big one will be obstetrics, especially for pregnancy. You can be referred to all the specialists, dermatologists. Family doctors have different roles here in Canada. It's not only doing the general medicine part. Some of them are a little bit more specialized. Some of them do obstetrics. There's family doctor clinics that deliver babies, and that's all they do. And they do a really great job. There's some other family doctors that specialize a little bit more into dermatology. So they can do, they do that more frequently, so they can help family doctors with diagnosis, or even sometimes with biopsies or other services for dermatology. There are some family doctors that do palliative care, especially for patients that are in the community. There are other family doctors like me that does long-term care. Long-term care is the medicine that we give for patients that need to live in a facility because they require care. Usually this patient have dementia, or they are not able to change themselves, dress themselves, so they need to be monitored and close to like a care aide and nursing to help with their care and their daily life. So that's what we do in long-term care. And there's also some family doctors that can do sports medicine, mainly because they focus on strains or pains or joint pain that is not getting better. Your family doctor or the walk-in clinic is the one that will do referrals, and the referral goes to a specialist. The big thing with the referrals and specialists is that when you have a problem, this is a big difference with a lot of countries, especially with mine in South America, as back home, we have, let's say I have a headache, I book myself an appointment with a neurologist, or I have a cough, I book myself an appointment with the respirologist. Here in Canada, there's a lot of things that your family doctors can manage. Specialists are being left for special cases that are more complicated, or they need more attention. If we have a problem that has not been solved after trying the basic things, that's when we send you to a specialist. In general, and what I usually say to a lot of my patients is, if you have a meeting with me because you want to see a specialist, I do still need to know the reason. I still need to try some things before I can send that letter to the specialist. The way that specialists work here is there's a very long wait. So when they read the referral, the specialist kind of triage. So they kind of they choose between which one I need to see fast and which one can wait. As a family doctor, the more information that I put there, the more that I show them that I already tried several things, that is a more complete referral, and that will be a good referral towards a specialist. There's also referrals that you need sometimes for your private insurance to cover partially or completely, like physiotherapy, massage therapy, podiatry. This referral can also be made by family doctor. As I've been saying through the talk, is specialists, when do I need one? First, I have to see what my family doctor that can do for me. One big one that I have all the time is, I have a kid, I need to see a pediatrician. Your family doctor can do the care for your kid in general. Usually family doctors take care of patients from cradle to until death, like until you're very old, right? Because we have an extended knowledge And usually if we do see something that is more complex, that is when we involve a specialist. Not all kids need to be seen by a pediatrician. Not all pregnancies need to be seen by a gynecologist. Not all rashes need to be seen by a dermatology. So usually the family doctor will be your first point of contact for them to be able to manage some of these things. The same thing happens with mental health. Mood disorders, I find that here in BC, a lot of the mental health system is managed by family doctors. Seeing a psychiatrist is a very long wait time, and sometimes the time is very limited because you're not feeling very well right now. So definitely talk to your family doctor. The main limitation with the specialist here in BC will be the wait times, and sometimes it can be 3 months to 6 months, depending on the specialty. There are some that is also 12 months or more. Those will be like the very specialized services. But again, if it's an urgent need, then sometimes that can be a little bit shorter. Blood work. The main thing that I've seen is, and the main question that as I mentioned before, is what can I order for blood work? I have a lot of patients that like, I want to know how my folic acid is, or my hormones, or I want to know how my B12 is, with no symptoms. So this will be not covered under your public insurance. Dietitians, naturopaths, they usually recommend for you to get some blood work, but again, they are not covered under your MSP. So their blood tests are not covered under MSP. A lot of people read things on the internet. I get a lot of requests of tests that are quite complex or quite pricey for diseases, for symptoms that are not or have not been studied before. First, your family doctor needs to, sometimes we need to follow the guidelines to see if you do qualify for something, or sometimes we need to wait until you see a specialist to see if you're able to get this test. Main thing that I have from a new immigrant is, in my country, they used to this test for me every month, like cholesterol, sugars. It's not very common to do that here unless you need it. There are some set times for certain tests, and that will all depend on your health. Big one that I see in the walk-in clinic is, I see a lot of patients with cold-like symptoms or new symptoms of disease that mainly request antibiotics. As family doctors, again, we have a lot of guidelines around antibiotics. It is proven that most infections are viral. Antibiotics are not a treatment for a viral infection. The main concern around antibiotics is that if we overuse antibiotics or we use it wrongly, the bacteria that live within our body can create resistance, and then the antibiotics that we have will not work anymore. And the other concern is that antibiotics can also give a lot of side effects, especially diarrhea, stomach pain, vaginal infection. So it's unnecessary if you do not need the antibiotics, but your family doctor will assess that according to the symptoms that you're having, right? The big thing from some countries is that a lot of people are able to buy medication directly from the pharmacy without a prescription. There are some medications, we call them over the counter, and usually you can go to any pharmacy, Safeway, Shoppers, and they will have all this medication available for you. But there are things, especially like antibiotics and other prescription medications, that you cannot buy them without a prescription. So sometimes there's people that come from other countries and bring their medication. There are some medications that are not available here in Canada, or there are some medications that are used differently here in Canada. So sometimes we as family doctor need to either change your dose or change the name of the medication that you use to find the same medication to be able to help you with your health. A lot of people bring medication from other countries. I find especially antibiotics, and they take them if they need them. I sometimes discourage this because sometimes I can mask the symptoms that you're having and does not allow me to do a proper assessment or be able to see the symptoms properly for me to be able to help you if you're sick. Why does the medication I used to take in my country is not available in Canada? This is mainly because the medication that we have here in Canada needs to be approved by Health Canada. And the way that it works here, for medication to be affordable, they buy certain brands and certain names. And there are times that there are some components that are not available here, but there could be, and we can find things that are alike, but we may need to change your medicine. Again, are my medications covered? Depends. As I mentioned before, pharmacare is available, but with a lot of limitations. Most medications need to be paid out of pocket by insurance. Services, counseling, not covered. Physiotherapy, not a benefit. There's a limitation on physiotherapy. Sometimes people with low income can have some benefit, but this is not determined by your doctor. You need to go through a process to apply for that. You don't need a referral again for optometrists or podiatry or other services that are not covered under MSP. The list that I have here is the list of medications. Oh, sorry, this form is for busy family doctors, and it's mainly describing the services that are not covered under your MSP. And it sets a fee of how much the maximum amount that a doctor could charge you from any of the services. All the services are not covered by MSP. And if you need one of them, you will have to either have some of them private insurance, some of them just out of pocket. The prices don't necessarily have to match the ones that you see on the screen. Sometimes, depending on the doctor or the service or the clinic, the prices could be under this number or just the number that you see on the screen. And I think that's my presentation today. I wonder if we're gonna have some questions.
Yes, absolutely. There's some questions. What a great presentation, Dr. Pesantez. And there are a number of questions, and some of them are fairly precise, and some of them are a little bit more, a little bit broader. So maybe we can, in the time that we have left, I can pass some of them along to you. One of them is around midwifery, and the question as to whether midwifery is covered by MSP.
It is. When you're pregnant and you want to see a midwife, the government will cover one service. It will not allow you to see a family doctor, maternity clinic, and a midwifery clinic. You need to choose one or the other. And depending on the midwifery clinic, if they see that your pregnancy is a little bit more complex and need a little bit more care, sometimes they are able to refer you to either a family doctor or a gynecologist.
Great. So you do have that choice, but it will be covered if you make the choice if you prefer to see a midwife. That's great. There's a question around patient medical records and walk-in clinics. And this is an assumption that I'm not sure is true. She says walk-in clinic also carry the patient's medical records, and some clinics allow walk-in patients to make an appointment with a specific doctor. If you can't find a doctor who speaks the same language as you, do I still need to find a family doctor, or will the walk-in clinic suffice?
Do both. I do my family practice and I do walk-in clinic. I do find, because a lot of patients look for me because of my language, I do find that my appointments and certain things that my family patients can access is different from the walk-in. So ideally you should have your family doctor. If you go to the same clinic and the tests are requested from the same clinic, the doctor that you see are able to see all the results. But for example, if you come to my clinic and you went to another walk-in clinic and you ask me to review the results, I am not able. Usually what I will have to request those tests, and it's a process. So that's why my advice is, if you go to one place, keep on with the same place, because they will have your information. Records are created every time that you see a doctor. So, but there's no cross coverage. We cannot see, because of privacy issues, we cannot see what other doctors have said or requested about you.
Great. So it's if you're going to use your walk-in clinic as your primary care provider, make sure you use the same walk-in clinic and hopefully the same doctor.
Yeah.
Yeah, great. And I guess the risk of that is, walk-in clinic doctors tend to work in walk-in clinics because they want some flexibility as to how they work, and sometimes they're not always there. So that's just sometimes the risk around that. So great.
Sometimes it's really difficult because depending on the walk-in clinic, there are some difficulties to book you with the same doctor all the time. So you may see different people. And the main thing is different doctors, even though we study the same and have the same guidelines, different doctors have different way of practice, and they have some experience with certain things and no others. So you sometimes can get conflicting information if you see more than one doctor. That's why it's good for you to have your family doctor.
Great. For children under 15 years old, are dental and vision covered under MSP?
No, my understanding is sometimes the eye exam under 5 years old is covered through your optometrist. Sometimes it's a gray zone, depending where you go, under 15 years old.
Great. And I think this one doesn't have a definite answer. What about general vaccinations and flu shots? Are they covered under MSP?
They are covered. So most vaccinations are required, especially for children. They are all covered under your MSP. Most people go to the health units, like we have the Burnaby health units that does all the vaccinations. There are some vaccines, like extended vaccines that say like shingles, hepatitis B, hepatitis A, and a lot of the adult vaccinations, except for COVID and flu, that are not covered under your MSP, and you will need to pay again out of pocket or via insurance.
Great. Okay. So then this last one's an interesting one, and it's about not being able to access the service in a timely manner in Canada. Can a patient request a CT or MRI results or imaging in order to be able to take those over to have treatment or surgery in another country?
You can always request your results. Like you're entitled to request your results regardless of the doctor that you see, because it's part of your file. Depending on so if you do have an appointment with the doctor and you get the CT scan results and you discuss CT scan results, sometimes the doctor can print it right there. Sometimes I've seen in some clinics, because of the process that it has to go through, it may have a charge, but some clinics do, but definitely you should be able to request for your results.
Great. And I guess then this is again around dental and vision. Is it free for people over 65?
I don't think dental is a free,
no.
It's a free for anybody, but again, like people at the extremes of age sometimes have a little bit more benefits. But especially if, let's say for dental, I'm pretty sure not, but for vision, sometimes, again, if it's medically necessary, it could be partially or fully covered by MSP, depending the optometrist and the office that you go to.
Great. Well, that's great. I think that's all the questions we have, which is good because it's all the time we have. I really want to thank you, Dr. Pesantez. What a great presentation. I do want to remind folks that the presentation it will be available online on the BurnabyPCN.ca website. And if you have other questions, you're certainly welcome to put forward to the when you get a sort of a follow-up email to put them forward to us, and we'll make sure that we get them to Dr. Pesantez or to the best place to answer them, and we'll get them back out to you. So again, really appreciated the presentation, Dr. Pesantez, and want to thank everybody for coming. Hope you enjoy your sunny Friday afternoon.
Thank you. Thank you, everybody, for coming, and thank you, Jeff, for your help.
Thank you, Dr. Pesantez. That was great.
Thank you.